Thank you, ladies and gentlemen. Supporting recommendation is great. Translating this support into actions add relevance and impact. FIP, as the global organization representing over 3 million pharmacists around the world, has invested $2 million over the last 5 years to support the development of robust education systems for pharmacists to ensure that there is a competent, well-distributed and sufficient pharmaceutical workforce. Our effort led to the organization last month of the first global conference on pharmacist education, which concluded with the adoption of a global vision for pharmaceutical education and workforce, 13 pharmaceutical workforce development goals, and 55 statements representing the international expectation of what an effective pharmaceutical education systems look like to meet local needs. All these documents clearly align with the work and the recommendation of the Commission and highlight how a health profession, in our cases pharmacists, can translate its support of the Commission's conclusions into action. While our activities will focus on most recommendations, I would like today to highlight commitments on 4 specific recommendations. The first one, recommendation 3, around education, training and skills. FIP will develop an action plan to support and monitor the implementation of the FIP global visions, the workforce development goals, as well as providing technical assistance to implement 55 statements on good pharmacy education system. We will also reflect the conclusions and the recommendation of the Commission in our new FIP statement of policy and on good pharmacy education practice. With regard to recommendation 4 on health service delivery and organization, FIP will continue to identify and share best practices on optimizing the contribution of community pharmacy in service delivery through the development of a report on the role of pharmacies as entry gates to healthcare system. This to be released in 2017. We'll continue to support our national association in being an active contributor in the national dialogue around health service delivery and organization through their personal technical assistance provided by our office. With regard to the recommendation 8 on partnership and cooperation, FIP is committed to continue its engagement in intersectoral collaboration, including in the newly established Global Health Workforce Network. Finally, with regard to the recommendation 10 on data, information and accountability, since 2006, FIP has been collecting data on pharmacists and other pharmaceutical workforce and analyze the trends. FIP is keen to participate in the efforts of the Interagency Global Data Exchange on Health Labor Market by sharing its expertise and data that will be gathered into an online FIP Global Pharmacy Observatory to be launched within 18 months. Please be assured of the commitment of FIP and the 3 million pharmacists in supporting the implementation of the recommendation of the Commission. Thank you for your attention.
Wonderful. Thank you very much. I would now like to call upon Dr.